like Seminole.
Oh, yeah.
Creativity that has come out of this.
Hmm?
The creativity that has come out of this.
Yeah, I'm not sure they're all effective, but some of them are quite pretty.
Very good. Batman's over here, so
Yeah.
I think some of it's live and some of it's recorded.
play it later tonight or something.
I guess. I'm not exactly sure. You know, I worry that as this all opens up, we may see.
Floodgates.
It won't happen right away. 3 to 5 weeks down the road, that's the problem.
Yeah. It's hard to measure the impact of everything that we're doing without waiting, 3, 4, 5 weeks, but time will tell.
Yeah.
I mean, the good news is there's enough. I mean, there's not enough testing, but there's enough that we'll get an idea of what's going on.
Well, that much in the runs, EMS runs,
Yeah.
I think are important for us to keep an eye on. And the fact that regular flu season's going down anyway.
This guy just showed up in general testing just a second.
Oh, this one right here.
Just showed up.
All right. Good afternoon, everyone. Welcome to Memorial Regional Hospital, the flagship hospital for Memorial Healthcare System. We welcome you today, welcome members of the press, and of course, we welcome our community that are seeing us in Facebook, and a community that will hear about this news, of course, much later. We want to first acknowledge our South Broward Hospital District Board of Commissioners. We have Commissioner Laura Raven Miller here with us. And also would like to acknowledge our President and CEO, Aurelio Fernandez, who is also present today. As Florida begins the process of reopening, as outlined by Governor Ron DeSantis, Memorial Healthcare System's medical leaders are here today to speak about the healthcare system readiness plan to provide elective and outpatient procedures in this era of COVID-19. Each of our medical experts are here, are also our medical experts here at Memorial who have been on the front lines making clinical decisions for our patients and our community during this pandemic. We'll speak to the safe measures taken to provide patient care during the time of COVID-19 and moving forward. We also want to thank our leaders here from EMS who are present today as a show of unity with us and as first responders working alongside with us. So to get started on this press conference, we're going to start with Dr. Stanley Marks, who's our Chief Medical Officer here at Memorial Healthcare System, and he has been also our incident commander here at Memorial during this pandemic. And I will introduce each doctor as we go along. We will have some remarks in Spanish after by Dr. Paula Eckert. And then we're going to go ahead and open it for questions for you. So thank you. Here's Dr. Stanley Marks.
Hi, I'm going to take my mask off because it's tough to speak through a mask. We're in unprecedented times right now. I had said to one of my colleagues a moment ago, who would have thought that we would be standing here today talking about a pandemic similar to one that occurred over 100 years ago in this country. Memorial Healthcare System is, I believe, the premier healthcare system in South Florida. And we are going to be open for business, really starting today. We are preparing, and as you can see behind me and in this great hall, which is a conference hall, we have set up essentially a pre-admission testing facility so that patients who come in and need invasive procedures, surgery, and the like can get all of their testing outside of the four walls of the hospital. But I think the most important message that I can bring about today to you all and to our community is that hospitals are safe. This hospital and our healthcare system's hospitals are certainly safe. Our COVID-19 patients, and we've had a fair number of COVID-19 patients, both in our regular units and in our intensive care units, are separated from the general patient population that are in our healthcare system, and they will remain separated. Those people who treat the COVID-19 patients are not the same people who are going to be treating and caring for the elective patients or urgent patients who otherwise might come into our healthcare system. We have the ability in every one of our hospitals to provide this level of pre-admission testing and this level of keeping the infectious patients, the COVID-19 patients, totally separated from any other patients that we deal with. I think it's going to be important also as my colleagues behind me begin to speak about the other kinds of diseases that we care for here at Memorial, that those diseases haven't gone away. This is Stroke Month. Dr. Brijesh Mera is going to talk about neurological disease and stroke and the fact that this disease is not protective against strokes or heart attacks or cancer or any other diseases that befall us as a society. It's critically important that patients understand if they have symptoms of heart disease or stroke or other maladies that may befall them, and they need to see a physician or they need to come to the hospital, they need to do so. It is critically important that they not put off serious illness. There are some statistics now coming out of other states that have shown increased mortality related to heart disease and severe neurological disease and cancer, which if not taken care of, only get worse. And in some instances, people have succumbed to these other illnesses. So I'm going to turn it back to Kurting to introduce the next speaker. And obviously, I'll be here along with the rest of the crew here to answer any questions that you have at the end of the program. And thank you all for being here today. And a special thanks to our EMS colleagues who are here really representing all of EMS throughout South Broward. Thank you.
Thank you, Dr. Marks. Our next speaker is going to be Dr. Randy Katz. He's our Medical Director of Emergency Services here at Memorial Regional Hospital, and he's also the Medical Director for the City of Hollywood Fire Rescue.
Hi, good afternoon. I've been working on the front lines, treating patients for the past 6 weeks, and I know that this crisis has led to less patients seeking emergency care. for stroke and cardiac symptoms and other disease entities for the past 6 weeks. The number of strokes and heart attacks we are treating has decreased, but we know that these things don't go on vacation during a pandemic. And it's heartbreaking to see patients arriving in the emergency department seeking care too late for us to help them. Every year, hundreds of thousands of people in the United States die from heart disease, cancer, and stroke. And time is brain, time is heart muscle, and preventative care saves lives. The sooner we can treat these conditions, the better the outcomes. Sometimes the difference is permanent disability versus a meaningful outcome and a meaningful quality of life with some of these things. The damage from ignoring heart attack symptoms, stroke symptoms, and avoiding chronic disease management will be felt for months and potentially even years from now. We cannot let another healthcare crisis unfold as we recover from this one. As of today, there are fewer and fewer COVID-19 patients in our community, and our hospitals are safe. We're not overwhelmed. We screen every patient that comes into our front door, and we test every patient for COVID-19 that goes upstairs. And as Dr. Marks mentioned, we do keep patients separate and keep people safe, both the patients and all of our employees and our healthcare providers. There's no reason to avoid emergency care, and our first responders here from Mera and the City of Pembroke Pines will tell you that our emergency rooms and our 911 systems are ready to receive patients and provide safe, effective, and quality care. Calling 911 early allows our system to activate resources, expedite care, and provide life-saving treatment for stroke, trauma, and other time-sensitive emergencies. Now, we still have to follow social distancing guidelines and practice good infection control guidelines in the community, but we should not let that stand in our way from seeking emergency care. Throughout this crisis, Memorial Healthcare System has maintained the highest standard of care, and we will continue to do so with our first responders for this community going forward. Thank you.
Thank you, Dr. Katz. Our next speaker is Dr. Mera, and he is our Medical Director of Stroke and Neurocritical Care Services for Memorial.
Thank you, Curtin. Thank you all for being here. I will definitely echo Dr. Marks and Dr. Katz's words and remarks. May every year marks Stroke Awareness Month, and during that time, we get out into the community, we educate the residents, the emergency medical services, the providers about the signs and symptoms of a stroke and what can be done in a time-sensitive fashion to save the outcomes of your loved ones. It has never been more important than now to reinforce the importance of coming to the hospital, recognizing the signs and symptoms of a stroke, calling 911 immediately, and not delaying timely care. Patients that previously are coming in paralyzed, unable to talk, unable to understand what others might be saying, we have treatments that are revolutionary, advanced over the last 5-8 years that can be night and day for the patients and the families. So previously, prior to the pandemic, our volumes, as Dr. Katz remarked, we were seeing upwards of a dozen stroke alerts come in per day. That volume steadily declined through mid to late March, and patients were eventually coming in, but to the point where it was too late to do anything out of any urgent, emergent treatment windows. And it is indeed very heartbreaking to see that. So what I really want to explain to the community is that we're ready. We have all the safety protocols in place. Anytime a patient comes into the hospital via the emergency room, via triage, all of the protective equipment is available in place to protect the staff and the patients. And time is of essence. We get the patients to the cath lab immediately. And as Dr. Katz said, time is brain. Every minute matters. Emergency medical service providers from Pines and Mera, we work with them closely with in-field stroke protocols to ensure that they also recognize the signs and symptoms of a stroke and we activate our cath lab as early as possible due to their pre-hospital stroke alerts. So the time-sensitive treatments, the clot-busting medications such as IV TPA and mechanical thrombectomy in the cath lab are paramount. That is what we can still offer to the residents of our community. And so I understand the fear might be there, but we just want to reassure you that you're better off coming to the hospital and seeking timely care rather than delaying it and then having a bad outcome. So thank you for the opportunity. Appreciate it.
Thank you, Dr. Mera. Next is Dr. Brett Cohen, and he is our Chief of Adult General Surgery.
Thank you very much, Kurting. I get the opportunity to talk to members of the press, to the community, a little bit about why we feel it's safe here in the Memorial Healthcare System, the changes that we've made to make it safe to come back to the hospitals as we make our way through this next phase in this pandemic. Memorial has once again poised itself as a leader in the community. We put patient care first. We put patient safety in the forefront, as we have always done. We have seen a lot of changes in our hospitals and the algorithms and the pathways in the physical layout of the hospitals over the last several weeks to make it safe for patients to re-engage back into the hospitals. And as Dr. Marks said, we are starting that process as of today of the community coming back into the hospital for routine hospital care. Some of the changes we see in the offices as we start to reopen our offices, even as early as today, we have rearranged our schedules. We're spacing out patient care in the offices, so patients come in as an individual appointment and won't run into anybody else. The waiting rooms have been changed, so chairs are spaced out, so if a patient does come in and there are other people there, there's places to sit, so you're not next to anybody. We continue to limit visitors through the offices as we do in the hospital, so there aren't as many contacts in the offices and in the hospitals, limiting that potential infectious contact. All patients are screened prior to coming into the office to make sure there are no signs using CDC guideline questionnaires, that there are signs of COVID-19 or other illnesses, and we extend that to our staff, our physicians, our extended providers. Every encounter is screened. Every person that comes through the offices and through the hospitals are screened appropriately to make sure we're not bringing anything in to our facilities. Extra time has been allotted throughout those appointments to allow for all of the offices to be cleaned appropriately. So once one patient is leaving, every surface area that's touched or come in contact is clean, so the next patient comes into a completely sterile environment. And we continue to offer our virtual visits through the office, so somebody that doesn't want to come in, somebody that can't come in or isn't quite ready, can still have a full encounter with their physician through the office through a video platform, and when the time is right, can come into the offices. In the hospital, we've taken a lot of the same precautions. I think you heard Dr. Marks and Dr. Katz mention that every patient that comes into the hospital through the emergency room is tested for COVID-19, so we know that status immediately. We know where those patients are going, and we do have separate units, as Dr. Marks mentioned, for patients that are COVID positive, and we separate them from the units that patients are going to go to that do not have COVID-19. The staff that takes care of those patients are separated from other units as well, so we are eliminating that exposure. We have the same limitation in family members coming through the hospital, so again, to limit that encounter as patients make their way through. And as we start to reintroduce procedures in the hospital, operations, interventional procedures, diagnostic procedures, and so forth, we've taken a lot of those same precautions. This center that you're standing in here is one of our new pre-admitting testing centers, like Dr. Marks mentioned, and these are going to be available throughout the entire Memorial Healthcare System that patients come to in advance of coming to the hospital. They get pre-registered, they get pre-checked in, they get their labs, they get to meet anesthesia, pharmacy, and ultimately we'll get a COVID-19 test so that we know that everybody coming in is COVID-19 negative. If someone does test positive, obviously an algorithm there to make sure that they're either treated by their primary care physician or needs to be brought in if appropriate. On the day of the procedures, patients are escorted to their diagnostic units where they're already been checked in for their procedures, have their procedures, and again, escorted back to their family members. Every physician, nurse, staff, and employee member in the hospital is as well being screened and temperature checked to make sure that we are not bringing anything into the hospital. So we're doing everything we can to protect our environment. The hospitals are safe, as Dr. Marks mentioned. None of these things that we have been treating for the longest of times goes away because there is a pandemic, and we recognize that, and it's time for us to get back to treating the community as Memorial has always done. We've made a decision to start the process in a slow and very calculated fashion, starting with elective procedures, and as we move forward, we'll be evaluating the process to make sure we're not using vital resources, things that we need to treat our community that still has a pandemic ongoing, and yet we can still take care of the community the way that Memorial does. I appreciate the time to share this with you. Thank you.
And our next speaker is going to be Dr. Paula Eckert. She is our Chief of Infectious Disease, and she will also provide some remarks in Spanish, and then we'll go ahead and open it for questions.
Good afternoon, everyone. I'm going to touch a little bit about what infection prevention measures we've taken at the hospital. Some of my colleagues have already talked about this before me, but I'm going to touch about testing. I want you guys to know that we have an excellent molecular lab that has conducted around 13,000 tests. We result all our tests here at the hospital. The turnaround time is very few hours. So that's why we're able to classify patients between having COVID and not, and then put them in appropriate parts in the hospital. Also, we will continue with universal masking of all employees and people that are coming into the hospital to make sure that the healthcare workers and the patients are protected. We will continue to use recommendations that the CDC has given for personal protective equipment, and we have sufficient personal protective equipment to continue to work with all of our units and the new strategy of opening up to preparative services. I wanted to touch also a little bit about some of the work that Memorial has done with the CBS Smith Park. Over there, we have conducted around 23,000 tests in conjunction with the state. We are following all those patients that test positive at the park with follow-up calls and referring those patients to telemedicine or to the ER if they need, and then discharges them from isolation when required. We're also doing multiple clinical studies at the hospital, including convalescent plasma, which we have streamlined the process to yesterday having a patient being transfused within 12 hours from the order. And we are also conducting the remdesivir trial at this facility with Gilead, and we will continue to do so along with the Gilead partnering. These are my remarks, and then I'm going to start saying some words in Spanish. Básicamente, la razón por la que estamos aquí es para mostrarle a la comunidad que estamos listos para abrir el hospital a procedimientos quirúrgicos electivos y para que la comunidad esté segura de que en Memorial van a tener el cuidado apropiado con los cuidados de expertos acerca de cualquier enfermedad, incluyendo accidentes cerebrovasculares, infartos de miocardio y cosas que la gente parece no haber estado viniendo al hospital porque los números de la emergencia han estado muy bajos desde que empezó COVID-19, y queremos expresarle a la comunidad que estamos tomando todas las medidas para hacerles los exámenes cuando las personas llegan al hospital para determinar quiénes tienen la enfermedad y quiénes no, así no tengan síntomas, para poderlos ubicar en las alas del hospital donde se están cuidando los pacientes con COVID-19. Sí hemos visto que ha disminuido la cantidad de pacientes con la enfermedad y estamos seguros de que con las diferentes estrategias que estamos implementando vamos a poder seguir adelante ayudando a la comunidad. Gracias.
And I'm going to ask Dr. Marks to come back and just give some closing remarks.
First of all, thank you all for being here today. I want to just summarize a few points. Memorial Healthcare System has always been at the forefront of high quality and safe care. And that is no different now in this pandemic than it ever was. We probably were the first in all of South Florida to have in-house testing and continue to maintain a very high level of in-house testing for all of our patients, any of our staff that needs it, and that will continue and will likely become enhanced over the next weeks to months as more testing becomes available. It is clearly important that testing is a foundation for safety in terms of opening up your services in a healthcare system. It's clearly important to understand who is and who is not positive. It helps us preserve personal protective gear. It helps us to understand who's positive and needs to be isolated, or who's positive and if they have an elective procedure that can be deferred or delayed. It's critically important that we protect our patients, but it's equally important that we protect our staff and our physicians. A hospital is nothing but a bunch of bricks and electronics without these key people and the nurses and technicians that support us. So the key thing is our people, our patients and our people, to keep them safe. So again, thank you, and thank you, first responders, for everything that you all do.
Thank you, Dr. Marks. We're going to go ahead and open it for questions. If any one of you guys have a question, and depending on the question, we'll call the right expert here. So we're opening it up for questions.
Thousands, probably tens of thousands. I mean, you're talking now about 6 to 8 weeks worth of, the first couple of weeks slowed down, and then pretty much a hard stop right before the governor actually announced a hard stop. We preempted that and announced a hard stop internally. Yeah, very good question. The issue with surgery and starting up surgery, as you probably are aware, there's a blood shortage. So on top of everything else that we're dealing with, the blood banks, not just here in South Florida, but around the country, have not had sufficient donors. And so there is a blood shortage. One of the things that our team that Dr. Cohn led was essentially to look at the kinds of cases that we would be doing. So we have been doing urgent and emergent cases. We have done, as a matter of fact, I had lunch today with one of the pediatric heart surgeons. We've done 5 pediatric heart cases last week that had to be done. The kids were sick and needed to be done. So we haven't not operated, and we haven't not done procedures and so on. But in a go-forward manner, we're going to look at those cases that don't require an ICU, if at all possible, that don't require blood, that can be relatively quick in and out kinds of cases. So those hearts that can be deferred, the heart surgery cases, we will. If they can't be deferred, we're going to do them. So urgent cases will get done. I don't have that particular answer. I do know the pediatric volume for last week. We haven't started doing elective procedures, no. May 11th, so this week, May 4th through the end of the week, we're gearing up. We're bringing patients in for preoperative evaluations. In earnest, we will start doing elective work the week of the 11th, and we will likely keep the ORs at, not at capacity, but well below capacity. As Dr. Cohn mentioned, we're trying to develop a program where we're not crowding patients in waiting rooms or in recovery areas. So it's going to be a slow tick up. That's the safest way to handle this. So we probably started around 25% capacity and begin to work up week over week, 50%, 75%. By the end of the month, hopefully, bring ourselves back up to 100% of our capacity. The important thing, I think, is for the patient population, our clients, to understand that this is safe. It's safe to get work done in the hospital. The natural tendency in a pandemic is to say, no, I don't want to go to a hospital. The issue is, I've seen demonstrations about people wanting to open up bars. Well, I think it makes a lot more sense to open up a hospital. So that's where we're headed, and we want to do it safe.
How will testing positive affect whether or not they get the procedure they're supposed to get?
If it's a purely elective procedure and they test positive, we're going to defer that. And generally speaking, the way we run somebody who tests positive, we would, if they're asymptomatic, at the end of 2 weeks, we would retest them. If they test negative, times 2, 24 hours apart, then we would reschedule their surgery. Yeah, pretty early on in this pandemic, we essentially, other than the Children's Hospital, there are no visitors, other than in very special circumstances in which, from a humane standpoint, people who are dying or families who have a special needs person that they're caring for, but there are no visitors. And that policy is going to stay in place, at least for the time being. We want to start very slow in the interest of safety. And again, not just for the patients that we're caring for, but for our staff as well. As you look around at the percent positive right now in Broward County, it's below 10%. In Dade County, it's around 14%. So it means that this disease is still prevalent in the community, and we have to guard against allowing too many people in the buildings. So it's just the whole notion of social distancing in the hospital isn't any different than it is anywhere else in society right now. Yes. Yeah, that is a critically important question that you just asked. Absolutely. We will be keeping our eyes on all of the data and all of the statistics. We're all hopeful that everything that the governor put in place in terms of social distancing, shutting things down, keeping it shut down in Dade, Broward, and Palm Beach was a very wise thing to do. And we hope that works, and we hope that continues. If we begin to see spikes in percentage positive, or in hospitalizations, or in EMS runs, or in the number of COVID positive patients that we're seeing, and deaths, and a variety of other statistics that we're collecting, we would have to pull it back. We don't want to do that, but if we have to, we will.
So the clinical trial that we're have the patients enrolled in is with the National Institute of Health and Gilead. So the data will be analyzed with them at some point because, they're going to gather all the information from other sites. And it's important to see it that way because that's where you're going to get the right information. We have enrolled around 10 patients in our trial. Anecdotally, you've seen in the news some cases of patients improving with the medication. Right now, we can only use it at Memorial Regional because it's through the clinical trial, and we are awaiting the distribution from the government of the medication that was approved with emergency authorization use. When did we start enrolling patients? Probably beginning of April or so. We have been one of the hospitals, the one hospital in South Florida that is part of the clinical trial. There are 2 sites and other sites in Florida, one in Sarasota and one I think in Fort Pierce. But our site is the only one in South Florida enrolling patients through the clinical trial. As soon as we saw that there was a possibility of, they put out and the National Institute website, Health website, they put out like the trials they're conducting. And what you do is you reach out and say, oh, we want to be part of it. And I think because we were a state that was going into the surge and we have a strong healthcare system, I think they thought we were a good match for their trial, and that's why we were selected.
Well, thank you everyone for coming. We truly appreciate your time. And the doctors will be here for any additional questions. We also have our amazing team of our nurses here with us that can provide a tour of this facility to the media if you guys would like to do that. And with this, we conclude our press conference. Thank you so much.